in the upper limb, we should be discussing its anatomy. And this is what is known as a brachial artery. So, anatomy of the brachial artery. So for the brachial artery, looking at this image, first of all, we usually identify it. This is the brachial artery. Okay, that's the brachial artery. It's a very prominent artery in the upper limb, and it rather gives rise to other arteries, So for the brachial artery, you should know that it's actually one of the main arteries of the upper arm. It's actually a continuation of the axillary artery, and it begins at the lower border of the teres major muscle, and it ends in the cubital fossa. So in the cubital fossa, it will now give rise to two branches. Okay, that's basically the radial artery and the what? Radial artery, and I think this should be the ulnar artery or so. Okay, so origin is actually a continuation of axillary artery, begins at the lower border of the teres major. Course, it runs down the medial aspect of the arm, initially medial to the humerus. Okay, so it travels with the medial nerve along most of its course, passes through the cubital fossa, okay, lying medially to the biceps tendon, then lateral to the medial nerve. So it terminates by dividing. That's why I told you guys that in the cubital fossa, it gives rise to what? The radial artery and the ulnar artery. Okay, that's it. So that the various branches of this artery, it gives rise to the profunda brachial artery, also known as the deep brachial artery, okay, which supplies the posterior aspect of the arm. It also gives rise to the superior ulnar collateral artery. It runs with the ulnar nerve, contributes to the elbow anastomosis. Okay, they also gives rise to the inferior ulnar collateral artery. I think we would have been picking them out, okay, but it's quite simple, right? Once you have been following me up with your atlas, it's simple. All right, so you can see superior ulnar collateral artery, radial ulnar collateral artery, all those branches are there. Okay, so it terminates by divide. Okay, no, spoken about that. So it also gives rise to the nutrient branches that supplies the humerus, gives rise to the muscular branches that supply muscles like the biceps brachii, the brachialis, the collateral brachialis. So it supplies arm muscles, both the anterior compartment and the posterior compartment. Supplies the elbow joint, supplies the forearm and the hand. So what's the clinical importance of this artery? So it's important because you can actually palpate for pulse of this in the cubital fossa. So it's important, it's a pulse point, okay? It can also be involved in traumas like humeral fractures. So there's risks of what? Reduced blood supply. So there's risks of ischemia. There's surgical relevance. It can be involved in vascular access, grafting, repair procedures, all those beautiful things. Then you can, because of the anastomosis and the various branches it gives, it can also be what? Collateral circulation. All right.